Good afternoon. I am Robert Rowland. This is medication administration. This is for simulation and education only. So at this time, I have received doctor's orders, as you can very well see, for patient sausage. I'm going to take my physician's orders to my MAR. I am going to go over and double check the proper medication to my MAR and the proper dosage and where the injection is supposed to go take place. I'm also going to double check my patient's allergies and make sure that my patient is not allergic to this. After that, I am going to gather my supplies. I have the medication A, and I'm going to get my syringes. I am going to do a intradermal injection at this time. So after I've gathered my supplies, I'm going to go ahead and do hand hygiene, wash my hands, possibly put gloves on if I need to. I am going to come back and double check my medication and my doctor's orders. I'm going to check the proper medication, the proper dosage. I'm going to check the date. I'm going to go ahead and check color and clarity for the proper medication. I'm also going to check the date and proper needle that I need. And at this time, it is 0.1 units. So at this time, I'm going to go ahead and draw up 0.1 of air. I'm going to go ahead and clean the top of the vial. Aseptically, I'm going to inject the air into the vial, invert it, and pull out just a little more than 0.1. Bump it a couple of times to get rid of air and push, get rid of air bubbles. I have 0.1. There's another air bubble. Make sure that you don't touch anything that you're not supposed to touch. Go ahead and remove my needle. At this time, I'm going to do the one-handed scoop method to recap it. I'm going to go ahead and label my syringe of the medication and the dosage that I have on it. I'm going to gather it with my doctor's orders. I'm going to go to the patient and verify that I have the proper patient. I'm going to ask them for their name and date of birth. I will also check it to their armband. I'm going to check and make sure that I have the proper medication in my hand to my physician's orders. I'm going to put the patient in a position of comfort for what I'm doing. At this time, I'm going to be doing it intradermal. So I'm going to gather my alcohol pad, and I will be doing this aseptically. At this time, I will allow this alcohol to go ahead and dry. Double check that I have the proper medication. Go ahead and remove the cap. After alcohol is dried, I will make sure the bevel's up, go at a 10 degree angle, right below the skin. And eject and look for a level. Go ahead and pull out. At this time, this is a contaminated needle. I will never cap a contaminated needle, and I will dispose of it into a sharps box. The benefit of this needle is that I have a safety feature which I can go ahead and activate. After disposing of my needle and making sure my patient is okay, I will go ahead and do my nursing documentation and make sure I document everything I needed to document of time, place and time, and the patient of the medication that I gave them. So I have another doctor's order for another injection for patient sausage. This is in a 1 milliliter IM injection. So at this time I will gather my supply. I will take my doctor's orders to my MAR. I will confirm it with my MAR of the doctor's orders of the proper medication, the proper dosage, and where that I would need to inject this medication. I would also double check my patient and make sure they don't have any allergies to this medication. I will gather my supplies. This is medication A and my needle. At this time, I will go ahead and do hand hygiene again, possibly wear gloves if I need to. I will go ahead and check my medication to my doctor's order, making sure that it's the proper medication, the proper dosage, and making sure the date is within date. I would go ahead and check for clarity and color for my medication. I will also go ahead and check my needle, make sure that it's the proper needle, make sure that it's within date. I will also go ahead and clean the top of my vial aseptically. This medication is for 1 milliliter IM. After opening my package for my needle, I will go ahead and draw up 1 milligram, which at this time is 1 milliliter. Go ahead and inject the air into the medication and withdraw 1 milliliter. Since I have a bunch of air, go ahead and draw a little bit more. After having 1 milliliter, go ahead and withdraw my needle. Using the one hand scoop method, I go ahead and recap it. I will go ahead and document this needle for the proper medication, the proper dosage. I will gather my doctor's orders and prescription medication. I will go to patient sausage and verify that I have the proper patient, asking him his name and date of birth and check it to his arm. I will go ahead and verify that I have the proper medication to my doctor's orders and the proper dosage. So at this time, we are doing an IM injection. I would inform the patient I'm doing an IM injection. I will go ahead and take an alcohol and clean the area. And I'll let it dry. As soon as it dries, I will get my medication. I will go ahead and check my medication to my doctor's order, uncut the needle, and explain to him this is going to be a little bit of stick. Go at a 90-degree angle, directly in, inject, and go ahead and pull out. Might have to use the alcohol pad if he starts bleeding a little bit. Since this is a contaminated needle, I will go ahead and dispose of this in the sharps box. I would never recap a dirty needle. At this time, I don't have one, so I will dispose of it. I will go and do my nursing documentation. I have received another doctor's orders for a subcutaneous injection. I am to take this to my MAR. I will double check it to my MAR, making sure that it's proper medication and the proper dosage, and check where I need to. I would also check for patient allergies to this medication. So I would also go and get my supplies, and at this time I have my insulin syringe and my medication A. At this time, I would go ahead and do hand hygiene as I need to, possible gloves if I need to. I will go back to my medication and doctor's orders and double check my proper medication, proper dosage, proper dates within time. I would go ahead and check for clarity and color for this medication, make sure that it is proper. I would also double check my syringe, making sure that it's within date, make sure that it's sterile and the proper needle. So this is uh, requesting 20 units of insulin or medication A. So at this time, I will go ahead and remove the safety feature off the bottom. Withdraw 20 units. I will clean the top of my vial. Make sure it's clean. I would go ahead and inject the air into medication A. And then I would withdraw 20 units. If this was an actual insulin, I would have already mixed it in my palm as a palm method. As you see, I have 20 units. Withdraw. Go ahead and recap the needle at the one-handed swoop method. I would go ahead and document this needle with the medication name and the dosage. I would take it with my orders to my patient, verifying it's the proper patient. Asking them their name and date of birth. I would verify to their armband. I will double check my syringe, making sure that it's the proper medication to the doctor's orders. And at this time, explain to the patient that I am giving them a subcutaneous injection. At this time, I will go ahead and clean the area and allow it to dry. I would get my needle, uncap it, and at this time, I will go ahead and do the injection at a 45-degree angle. At this time, depending on where you inject, you might need to go ahead and pinch it a little bit. 45-degree angle with the bevel up. And go ahead and inject, pull out. Go ahead and dispose of the sharps box. Because it's a contaminated needle, you'll never recap it. If you need to, you could put a band-aid on it, then go and do nursing documentation for the patient. That is the conclusion of medication administration. So this is medication sites. So intradermal, we would be doing injection on the inner part of the arm, right in here. The upper back. Be careful of the clavicle. And the upper part of the arm. Subcutaneous. So subcutaneous, we would be doing an injection. We can do the upper part of the arm. The upper part of the back. So you'll lean back. We could do the hip. We could do the thigh. Typically, we would do the top or the side of the thigh. And we could do the abdomen as long as it's not within 1 inch of the umbilical cord. Umbilicus. For intermuscular, we would go to the mass, 3 fingers down. And this is the deltoid. We do an IM there. We would do an IM in the valuus lataris. If you would move your hands for a second. Use your hand. Go up 1. You would also go down 1. That would provide a box right here. You would do it on the outer side of the thigh of that box. So at this time, if I can get you to lay down on your left side. So the venerogladular, we would go to the greater trainer. We would put the palm on that. We would find the iliac crest. we would find the index anterior superior iliac crest. Separate the 3 fingers, and that would give you where you would do an IM injection for that. For the dorsal gluteal, if healthcare policy would allow, similar, you would put palm on the greater trunk and the iliac crest, and you would do an injection right there. That is it for the sites.